that just ended. 1,080,039 doses administered. A week ago today, our total doses administered was about 936,000, a weekly increase of over 143,000 doses. The best numbers of all, 81% of adults ages 70 and older have received at least one dose of the vaccine. Our age 65 to 69 population is now right at 70%, I think 69 and change, which is great news. And our 50 to 64-year-olds now, more than 40% of them have been vaccinated. Now, we don't keep a list of comorbidities. We don't ask those questions when people get vaccinated, but we do know that a significant number of people under the age of 50 with comorbidities have also been able to get vaccinated. For our transmission index, I'm excited to announce that we have several more counties that have moved into the moderate transmission level. We only have 5 counties in high right now, 18 in moderate, and 6 in low transmission. The new counties transitioning to moderate this week include Carbon, Summit, Duchesne, and Carbon and Summit are moving to moderate, with Duchesne and San Juan County moving into low. And I think that's all. That's a lot, but we have plenty of time for questions. So with that, we'll go ahead and open it up.
Governor, you're saying you're encouraging people to continue to wear masks until everyone is vaccinated. You have a bill that sets a deadline to lift the statewide mask mandate. Your own Department of Health and the Lieutenant Governor said you anticipate about 900,000 people will be vaccinated by April 10th with just one dose. Are you playing with fire if you sign the endgame bill?
Well, we're not playing with fire. We're playing with the legislature, which maybe there's not a difference. I don't know sometimes. But we look again. I've talked about this several times over the past couple of weeks. We are really happy with where things are right now. We are seeing case counts go down and vaccines go up. That's great news. We have a law that has been passed that will allow the mask mandate to go away, but only a portion of the mask mandate. We still have a mask mandate for large gatherings, which is where those super spreader events are likely to happen, and so it's really important to have masks in those areas. We also have masks still in schools in that population where so much of the early spread was happening. And of course, businesses still have the opportunity to require masks in their places of business. And we all have the ability to wear masks ourselves. And we can do that. And that's okay. I'm going to continue to wear a mask until I'm fully vaccinated and hopeful that everybody else gets an opportunity. I have not been vaccinated yet. I anticipate that I will get vaccinated once we lower the age limit starting next week. Really looking forward to that. It's something that we've been waiting for, and so we can still keep people safe, and we've seen that in other states. We've seen it in states that, quite frankly, that don't have mask mandates. People are still wearing masks at similar rates. Seen from our own numbers as we've done some polling throughout the state, that people listen. People are smarter than we give them credit for, and we give them good data, good information. And if they know that there is still spread happening, they know that people haven't been vaccinated yet. Maybe they haven't been vaccinated yet. That they will still wear masks, and so we'll continue to encourage people to wear masks and to follow the health guidance rather than a law that forces them to do that.
Can counties create mask mandates under the bill if they want to?
I should know the answer to that. I believe that it does allow an opportunity. I shouldn't answer without knowing for sure. Let me check that and make sure and get back to you.
Speaking of vetoes, Governor, you've got a number of bills still on your desk. One of them that's attracted some attention is about mandated porn filters for devices. Do you have a sense yet if that's something you'll sign or veto?
So that is on our list to review starting Monday, I think. So we just go through these in a kind of an organized fashion. So we have not talked about that bill with our team yet. All of that being said, there is some misreporting that's been happening at the national level on this, not our local partners. You guys have all been great. This bill really does nothing right now. and I think it's important to point that out. It only does something if several other states pass a similar legislation. And I don't know if that's likely to happen or not. What I do know is that that when we do talk to parents, it's very difficult for parents right now to and iPhones, I have to say, are the worst when it comes to parental filters. I had a friend the other day who said, one of his kids had an Android, another one had an iPhone. It took about 5 minutes to set up the parental controls on the Android, and it took like 5 hours on the iPhone. And this is somebody who understands tech really well. And so I think we can do better. And I do think that pornography is a problem with especially with younger people, and what it does to their brains when they don't have a real ability to understand and to make those choices. So really, we want to empower parents. I'll take a hard look at the bill and see what it does. If nothing else, it sends an important message, I think, to people that we need to do better there, and then we'll see what other states do.
What about the social media moderation bill? Are you looking at that one?
Yeah, that's also on our list to talk about. We've had a lot of pushback on that bill. I think we all have concerns with social media right now, and as I've talked to the sponsor, as we talked to the president of the Senate, who is very involved with that bill, they're all concerned, and I don't know that they have the same concerns that maybe this bill is being has been kind of portrayed as. This isn't we're worried that Donald Trump was kicked off of Twitter bill. It's more we're worried about the way that social media is the toxicity that's happening around social media, and how we moderate that in positive ways, as opposed to just algorithms, and then making sure again that people have the ability to share their thoughts, even if they are unpopular, in a way that is consistent with the First Amendment. Now, I recognize that these companies are private companies, and they are not controlled by the First Amendment, and so that's part of the conversation that's happening out there. There's some arguments over whether or not the bill is constitutional or not, and so I have concerns with the bill, and I have concerns with social media, and we're continuing to have those conversations about how to solve this the right way.
I had a follow-up on the mask mandate and the change there. Most lawmakers are 50 plus. They've had a chance to get the vaccine, so any increased risk won't really affect them as much. For the Utahns who have been patient, who've done what you've asked, who have not cut in line, I'm sure many of them would rather no maskless people be running around. Lifting the mandate will increase the number of maskless people who are out there. What's the upside to that? And what's your message to people who have been patient?
Well, my message is get vaccinated, because starting next Wednesday, again, vaccines will be open to everyone, and we're speeding that timeline up. We're getting we'll be getting additional doses and helping people get vaccinated as quickly as possible. As to the upside, you'll have to ask the legislature about that. I don't know that there is much upside at all. This is not what we wanted. I've been critical of it from the beginning. We had a timeline that we set out. The legislature disagreed with that. We negotiated. We got as many days as we could, and so that's where we are. What I will say though is the good news for everyone is, again, case counts are really, really low, and masks have improved. We now know how to protect ourselves with masks, and so we're all going to have to make those decisions. And we've seen that. We've seen again, think about the places where you're going to go, where you will be you will be connected to lots of people that could put you at higher risk, right? So we still have a mask mandate for those gatherings of 50 plus, which I think is really important. We've seen, I think Harmon's yesterday mentioned that they're going to continue to require masks, which is absolutely their right, and people need to respect that, and they should, and wear masks. We'll be encouraging people to continue to wear masks. And so again, I think we're probably making a bigger deal of this than the science shows that it will be, because again, I really do believe that lots of people, most people, will still continue to wear masks even after that mandate goes away.
So why not veto it and make them own their vote then?
Because
if you're that concerned about it.
Look, that's a great question, and it's still a possibility, but when I negotiate with the legislature, right? When I engage in those conversations, and this is the practical piece that I think a lot of people don't understand of the sausage making, right? When we have a choice every time, we can just say, hey, we're going to veto that bill and we're not going to negotiate. But when I involve myself in the negotiations, then I have to do what I believe is best for the state, and I have to get as much as I can. We believed that they had the votes to override a veto for an immediate end to masks. I believe that wholeheartedly. Now, some people may disagree with me, and that's fine. But in those conversations, once I engaged, I had to say, look, we need more time. And so we started negotiating, and the spot we got to was April 10th. And if they would get to April 10th, buying us an extra month, then I wouldn't veto the bill. And so I felt like that was the best thing to do. I got an extra month. And so I can't tell them, hey, I'm going to negotiate and then turn around and veto your bill. That's how you lose the respect of the legislature. And that's not how I operate. When I work with them and I work closely with them and I try to get the best option for the state of Utah, that's how the negotiation works. Lawmaking isn't pretty. It's difficult. There are always give and takes, and those are decisions we had to make. But we felt comfortable, even public health, by the way, while this is not what they wanted, by seeing case numbers coming down, the weather's warming up, people are outside more, knowing that we're vaccinating 25,000 people every day, new people, then we feel more comfortable with where we're going to go. Now, time will tell. And again, I've said this before, if we see this turnaround and case numbers start going up significantly, or new variants come in and there are problems, we can call the legislature back into session and say, hey, we have a new problem. You've wanted to be a part of this from the very beginning. And that's the other thing I think people don't realize is governors across the country have been using the legislature's authority to do these types of things. This really is a legislative decision. We get emergency powers, and emergency powers are the ability of the executive to act like a legislature. That's what emergency powers do. I get to act like the legislature when I declare an emergency. That's very dangerous, and it should be used very rarely. And we've never had a situation in any of our lifetimes where we've had emergencies that lasted this long. And so it's important to get the legislature involved. And I've committed to that, and I've worked with legislative leadership. And so we're going to keep them involved, and they can help with these decisions that are part of their constitutional authority.
Any quick follow-ups in the studio? Okay, let's go to a quick remote reporter. We have Sonia Hudson with KUER. Go ahead.
Hi, Governor. You touched on this a little bit in your opening remarks, but there is a disproportionately lower rate of vaccinations for racial minorities in Utah. And I know that the state put out a vaccine equity plan earlier this month, and I'm wondering if you can talk about what part of that plan has been implemented, what still needs to be done, and if you've seen any improvement in the equity of vaccine rollout. Yeah,
thank you, Sonia. It is something that we're deeply concerned about, and this is not just a Utah thing. This is true across the country. And so we have implemented the entire plan with our local health districts. They are all working on this, and that's one of the reasons, again, that they asked to open this up to everyone, because it will significantly help them with the equity piece of this. And so we're just really excited. They're chomping at the bit, ready to go, but having to pick and choose which people in that population that they're able to vaccinate it, they said, has made it very difficult for them. So now what they'll be able to do is set aside doses specifically for those populations, go in with our mobile clinics, with different providers who and have close contacts who are trusted providers in those areas, and just go to town vaccinating as many people as possible. We really think that will help close the gap. And by the way, this isn't just equity for the sake of which is important. But as we look at the numbers, in order for us to hit something close to herd immunity, we have to reach these populations in a significant way. It's not enough to just do 70% of the general population, but have these pockets where we're at 30% or 40%. We have to do better. So we are committed. We're going in with everything we have to close that delta. Thank you.
Okay, that's all the time we have for our television broadcast. So join us back here for the Governor's Monthly News Conference next month. Okay, and we'd like to continue on with our remote reporters. Lisa Riley Roach with Deseret News. Go ahead.
Hi, Governor. Thank you. I'm wondering what you meant when you said it's still a possibility that you could veto the bill setting that April 10th lifting of the mask mandate, and also pretty much eliminating any opportunity for restrictions once you hit that 1.63 million vaccine total, especially since, yes, you're opening up vaccines to everyone early, but just because you get a dose doesn't mean you're fully vaccinated. That takes at least 2 weeks after a single dose and up to a month or more, depending on which of the multi-dose vaccines you get. So the reality is most Utahns will not be fully vaccinated for some time, far after that April 10th date. So what would it take to, when you say it's still a possibility, what would it take for you to veto that bill at this point?
Well, when I say it's still a possibility, what I mean is I haven't signed it yet. So anything's possible until next Thursday when the signing period ends. And so, I don't know what it would take, and I don't want to speculate. But what we're seeing now is case numbers are continuing to go down. And again, I think I've answered this question like 50 times. So we'll go on to the next question.
Well, actually, I do have a follow-up. Sorry. You said that that you've answered this question, but the reality is that there is still the possibility that the variant comes, that cases do go back up. So are you waiting as long as you can to see if indeed that happens? Is that what you mean when you say it's still a possibility? You want to make sure that cases don't start climbing, that the positive trends we're seeing don't reverse? Because that's what they're seeing in Europe. Italy is shut down. The UK is shut down. Other countries are facing huge surges again.
Right. And Europe is significantly behind us in vaccinations. They've done a terrible job of getting their people vaccinated. So again, I think I've answered this 51 times now. So we'll go on to the next question.
Okay, Chris Reed with St. George News. Go ahead with your question.
Thank you. Good morning, Governor. Turning to back to the declaration of drought. You've mentioned before, at least in your campaign, about the Lake Powell pipeline, which is designed to bring water to southern Utah. And I'm turning this to another subject, which is the visit next month of the new Secretary of the Interior. I know you're going to bring up the subject of national monuments. Is the Lake Powell pipeline going to come up? And how do you deal with the concern of environmentalists on that?
Yeah, I don't. The visit by Secretary Holland next month is very specific to the monuments question. We appreciate the Secretary's willingness to come out and have this visit with us. That was really important, and she was gracious enough, both in her confirmation hearings where she said she would be willing to do that, and then in conversations that we've had with the Department of Interior to make sure that visit happens. And I think that's important for everyone. So I don't anticipate that specific issue will come up. But look, water development in the state has always been important, and will continue to be important for every person in the state, especially in those rapidly growing places like southern Utah and Washington County in particular. And so I'm very grateful for our predecessors, our ancestors who came to this place, who developed water, who put reservoirs into place that have made it possible for all of us to live and thrive. And I believe we owe that to the coming generation to be just as responsible as they were in making those hard choices and in making those investments. And so I will continue to support projects like that we know are absolutely necessary. Now, that doesn't mean that we don't focus on conservation. In fact, it's just the opposite. We have to focus on conservation in a very big way. We have to do better, and we're committed to doing that. that, as are the various water districts through the state. We continue to meet with them. There was a bill passed that in fact, there were over 500 bills passed, and we tend to focus on maybe 10 of them. But there were several others that are really important. One of those bills was a bill that would require plans for metering of secondary water. That's a really big deal and will help us in the water conservation part of water security over the next 50 years. I think that was a bill that Senator McKell ran, and really important and impressive bill. So those are the kind of practical things that we'll be working on while the Lake Powell pipeline gets all of the attention. It doesn't mean it's the only thing we're doing. And so that's the message. It's really an all of the above approach to the way that we manage water. And we're going to have to be more careful and more diligent in doing that over the next few years.
To that note, are you expecting further restrictions this summer on when it comes to the drought?
So we'll watch that very closely when it comes to restrictions, and those restrictions are usually done at the water district level. I can just tell you on my own farm, depending on the year, we make those decisions all the times. In years like this, we're often under restrictions by the 1st of June. Other times, in times of plenty, we're not under restrictions until August. It's timeframes. So I anticipate, depending on the locale, depending on which reservoir storage you're under, that we will see restrictions fairly early this year. And I know there was a follow-up. Sorry.
And my apologies. I just want to ask, what do you think the timeline is at this point for the Lake Powell pipeline? It's been talked about for well, I mean, I can even say decades, but where does it stand at this point?
Yeah, that's probably a better question for the local water district there that is directly involved in those negotiations. But we have been very supportive of everything that's happening there. There are a lot of hurdles that obviously have to be jumped through for this, but we're closer than we've ever been in moving this forward. There were also, again, some changes that were made at the legislative level this year. We have a new commission, a Colorado River Commission, that will be working towards the renewal of the Colorado River Compact that's coming up very soon. We also set aside a significant amount of money to be able to fund those efforts. Again, making sure that we're protecting water for the state of Utah. So we're very very hopeful and optimistic on what's happening. Obviously, with the change of administration, we'll be working closely as we go through the permitting process. Again, we're close and hope to have those things moving forward this year so we can actually get started on the project.
Okay, Jacob with KSL.com, go ahead with your question.
Good morning, Governor. I think last week Dr. Dunn mentioned that we're kind of hitting another plateau in cases. It looks like they're at 560 new ones today, so it's kind of holding in that like 400 to 600 range each day. Obviously, we're vaccinating more people every week, but you mentioned earlier that we'll need to keep wearing masks until we have enough people vaccinated. I guess, how do you keep people engaged and wanting to continue with all those health measures that we've been talking about for the last year? Even as we're continuing to vaccinate more people and we're seeing that mask mandate lifting coming soon. What do you do to keep people engaged and not wanting to, be a little more lax and loosen themselves with their own restrictions?
Well, I hope that we can do that again with your help. That's why we continue to have these press conferences. We continue to use social media. I can tell you that's not my concern right now. My biggest concern, and I will say that while we did see a plateau last week, I think cases only fell about 3%, which isn't nothing. That's good news. They still fell. But this week we're seeing a bigger decline than we did last week. And again, the case numbers today. I always have to remind people, and I think we should. I hope people know this right now. But we don't compare cases one day to the next, because every day of the week has a different flow to it. The best way to compare cases is this day of the week versus this same day last week. That's how you compare cases to see if you're declining. So we don't look at what Monday, Tuesday, Wednesday look like. We look at Monday versus last Monday, Tuesday versus last Tuesday, Wednesday versus last Tuesday or Wednesday. So for those at home, if you're curious to see what's really happening, that's how you tell what's happening. And so the good news again today, we saw, I think it was about an 18% decrease from this day last week. Now, yesterday we did see a slight increase, but Monday and Tuesday were fairly significant decreases as well, 10% plus. So we feel good about that. And to see those numbers below 500 for the first time. The other number that I would recommend that people watch is the percent positivity, because that's kind of a precursor to where we are with cases. And our percent positivity, we have two metrics. One is the test over test, of which we've been below 10, which is a good number for quite a while. And then, the test over test is below 5%, which is a really good number. And then the people, the number of people who are testing every 90 days, and that metric is below 10%. So those are all still trending in the right direction. And then the lagging indicators, which are hospitalizations and deaths, which continue to fall in a very, very positive way. So I just want to point that out. But I said, that's not what I'm concerned about right now. And I can't wait for that narrative to flip a little bit. What I'm concerned about right now is the willingness of people to get vaccinated. That matters to me so much more than case counts right now, because ultimately that's how we end this and how we end this long term. And so what I worry about is as case counts go down, and restrictions are loosened and people feel more comfortable, that they'll feel like maybe they don't need to get vaccinated. That worries me more than anything right now. And so we have a media campaign that's going on. We've been talking to the White House. Some of the funding coming out of this latest stimulus package involve media campaigns, and we've asked that we keep a lot of that locally. Every state believes that we can do a better job of messaging that locally with people that are recognizable. I want to thank our comms teams and our vendor partners who are helping to get that word out. If you haven't seen some of our ads that are going out, you'll be seeing more of them. But it's this idea, if you want to get back to this, and it's people in concerts and hugging their kids, all those the things that we miss most, then get this, and it's showing people getting shots in arms. And so I anticipate when it's my turn to get a vaccine, we'll try to make that as public as possible. We'll invite you guys to come, just hoping to show to people that it's safe, that it's effective, and that it really matters. So honestly, that's what worries me more than masks right now is people's willingness to get vaccinated.
Okay, Katie with Deseret News, go ahead with your question.
Hi, Governor. You touched on vaccinations for hard to reach populations, and I'm curious about your thoughts on where vaccines are right now for the homeless population. Have enough homeless Utahns been vaccinated?
Yeah, well, not enough have been vaccinated yet. And so we're working closely with our county health departments. Obviously, Salt Lake County has the largest population and is home to by far the largest percentage of our resource centers for our homeless population. We've done pretty well there. I was talking with my senior advisor, Pamela Atkinson, about this just a while back. And she said it's been remarkable. They've been able to go out and the vaccine uptake rate has been really good with those over the age of 50 who were eligible. And we've had several special vaccination clinics going specifically to the shelters, the resource centers to make that happen. But by making this change next week, that's and again, this is one of the reasons it was requested. It will allow those partners to go out and not just at the resource centers, but everywhere that we find our friends experiencing homelessness, and vaccinate all of them, regardless of their age, comorbidities. They don't have to worry about that at all. They can just go and offer the vaccine to everyone. And so we're very optimistic that with this change, we'll be able to reach an even more significant portion of the population and keep them safe. I will say I just have to give a shout out to our partners since we're talking about it. We've seen with the spread of coronavirus in other states just devastating effects with the homeless population in those states. We've done a remarkable job here, and I'm not taking credit. We meaning our partners who help with this population. We've had significant testing events. Anytime there was any spread in those congregant living facilities to help prevent that spread. And while we have had some outbreaks, they've been nothing like we've seen elsewhere in the country. And so we're grateful for that. And getting them vaccinated will just protect lives.
Do you have any sense of where vaccinations are at with frontline workers? I wonder, especially with if the mask mandate lifts, if those folks have had a chance to get their shot, if they don't fall into any of the other risk groups.
Right, and we have not opened it to any other eligible category outside of using a risk-based approach. That was very deliberative. We understand, and my heart goes out to everyone that wants a vaccine and that feels like they should be further up in line. We've only made a couple exceptions. One is to our healthcare workers and first responders, and then teachers. Those are the only two categories that did not follow a risk-based assessment. And the reason for that is just very simple. First of all, I can't tell you how every industry feels like they're essential and that they're frontline workers. We've heard, airline pilots. We've heard, of course, our grocery workers. We've heard from people who work with utilities. I have a list of at least 50 industries that feel like they should be prioritized. And it's been hard to tell them no. It's been really hard, but there's a very good reason that we've had to tell them no. And it's very simple. If I give a shot to a 25-year-old who works for an airline or a 25-year-old who checks gas meters, that means that there's an 80-year-old who is not going to get that vaccine. And that 80-year-old is exponentially more likely to end up in the hospital or dead than that 25-year-old. And so science would tell you that that's a terrible, terrible, terrible mistake. If what we're really trying to accomplish here is to lower lower hospitalizations to protect our healthcare system and to lower death, which I think is what we're trying to do, right? I mean, if you're 25 and you get sick for a couple days and that's it, well, there are lots of things that do that, right? And so now we know that doesn't mean there isn't risk. There is risk. There's inherent risk to everyone. But by doing it the way we've done it, I believe that's why we're seeing our fatality rates continue to go down, our hospitalizations have gone down, and our case rates are going down. And so I think we did it the right way. I think most Utahns agree with that. And what we've done is, if you are over the age of 50 and have a comorbidity and you work at a grocery store, then you're eligible and you can get that. And so we've had to make some terrible trade-offs during this pandemic. That's what pandemics are. Pandemics mean you have to choose the best of a lot of really, really terrible things. And we've tried to choose the best of those really terrible things at every turn. And we've made some mistakes, but I will stand by that one. And of course, again, we encourage people as soon as you're eligible, starting next Wednesday for everyone. Right now, for those over the age of 50 with underlying comorbidities, please, 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 please get your vaccine.
Okay, Katie with Deseret News has a follow-up question. Okay. Go ahead, Katie.
Hi. Yeah, sorry. One more question. Yesterday, inland port activists delivered a letter calling a need to veto the infrastructure bill. What do you say to their calls to veto?
Well, I surely appreciate it's always a positive when people get involved in the process and making your voice heard. We need more of that. We need more people to pay attention to get involved. I have received their petition. I have had an opportunity to review their concerns and recognize those. Although I disagree with them, I've been very supportive of the inland port and especially this piece, which expands those opportunities into rural Utah, where that infrastructure is desperately needed, and where it will make an impact on those communities in a very positive way. I would actually argue that this will take pressure off of the main inland port in Salt Lake and move some of those projects out of Salt Lake, which I think would be a benefit to those who oppose the inland port. The inland port already passed. The inland port is in law. The inland port is already happening. What this bank allows us to do now is to put the infrastructure in place to make sure that it's successful. I will also say that I've had several conversations with the inland port, with their board, with their executive director, and others. And what I'm seeing around the environmental piece of what they're doing out there is truly remarkable, and something that isn't happening in other places in the country. And I think it's something we'll all be able to be really proud of. Get trucks off the road, which will be good for our air quality, and it will what they're putting into place out there with alternative energy sources, including solar and potentially hydrogen. There are so many awesome things happening out there, and so I will be signing that bill.
All right. Any other questions? Okay.
Yes, actually, sorry. Governor, you mentioned earlier and we're talking earlier about vaccine hesitancy and overcoming that. There was a recent NPR survey from last week that found 30% of adults nationwide say they don't plan on getting vaccinated. And the group with the highest refusal was Republican men at 49%. As a Republican man, what do you say to this group to convince them to get their shots?
Yeah, I saw that report. Those numbers are a little different than the numbers here in Utah. We've been fortunate in Utah to show that many people are interested in getting this vaccine. In fact, I think we've been as high as second nationally when it comes to a willingness to get the vaccine. So I feel good about it. That being said, I think those breakdowns would be accurate here. It's very likely that Republican males are more hesitant than some others. And so my message to them is just do it, guys. Again, that's ironically, that's the same group that is probably most adamant that we need to get back to normal as soon as possible. And so I think we have an opportunity, and this is important. When I say vaccine hesitancy, I've mentioned some of our multicultural communities, but it's also rural, and that would match up as well, right? Those of us in rural Utah, like me, we tend to be more conservative, especially men, and so we know that there's higher vaccine hesitancy amongst that group. And what I would say is, like, the thing that you've been arguing for the most over the past year is now here, and it's really simple. It's safe. We have ample evidence now that shows that it's safe and that it actually works, and so we're going to be, look, I don't know that the governor's going to change their minds, but I think there are some other people out there potentially who could change their minds. Those same people tend to be more religious, and so we'll be leaning heavily on our religious communities to help get the message out there that the vaccinations work and that they're important. Looking for, as we get more doses and vaccine hesitancy grows, or it doesn't grow but becomes the obstacle to overcome, then we can do different things with these vaccines. We don't have to do them down the road in these mass vaccination sites where you have to make an appointment and show up. What we can do is we can do them at different locales much closer to people, We're doing some of that already, but we could do them at churches. We could do them for church activities. We could have people administering doses that are part of that community. So there's a whole bunch of really interesting things that we can do, and we'll be committed to working with those partners, whomever they are, political parties, faith-based groups, volunteer organizations. We're open to working with any institution in this state that will help get more people vaccinated.
You've got a couple more minutes. I have two questions on totally different topics.
Okay.
One is
okay? Yeah, we're good.
One's a very quick follow-up on the porn filter bill. Just wondering if some of the constitutional concerns that have been brought up kind of give you any pause, or how that kind of plays into your thinking on it.
They would probably give me more pause if this bill was actually going into effect, but where it's not, we'll have plenty of time. I don't anticipate that there are any other states that I know of that will be passing a bill like this year. It's very common for us to work on legislation over the course of years to solve some of those problems, and so I'm less concerned about that right now. I think we'll have plenty of time to work through those issues before the bill actually requires any device manufacturers to actually do anything.
And the other one was to take it back to Bears Ears. I know there was a meeting on that yesterday, and wondering if you had any thoughts on what you'd like to see happen with the Interior Secretary coming to visit shortly.
Well, what I would love to see happen, and we've been very consistent on this with our congressional delegation. We've all been working closely. We've reached out and had several meetings with the Tribal Coalition, and they've been incredibly productive. I will say that I think the nature of these discussions is far different than it was 5 years ago. I think that it's been very respectful, the dialogue. There's been an interest in really finding a permanent solution. I think the one thing that we're all wary of, regardless of what side you're on with this, is this ping-ponging back and forth depending on who's president. It's one of the things I hate about the Antiquities Act. It's the most un-American of laws. I talked about my emergency powers and how I'm usurping the power of the legislature. The Antiquities Act does that in droves. I happen to think that it's unconstitutional as it's been used over the past several years. Now we don't have a Supreme Court that's decided that yet, but the original intent of it was kind of smaller areas, to have multiple areas that are bigger than some states at the stroke of a pen. Now, again, that's my argument. Of course, if you're on the other side, you love it. You love it when a Democrat's president, and you hate it when a Republican's president, because then by the same argument, you can just undo those. And I think we all want to get away from that. The other thing that I think is important is that just by designating this massive area, there are no resources. The Antiquities Act does not give the authority of the president to give any resources at all to these areas. And I've used this comparison before, but you'll all remember, we talked about the earthquake. You'll remember the monolith that was found in the desert that aliens had surely put there for several years before it was discovered. And then what immediately happened after it was discovered, thousands of people flocked to that area. They tore it up. They ruined the landscape. It was pretty awful. Similar things happened in the Bears Ears area with that monument that was declared, but no additional resources were given there. And what happened is people came from all over the world. They got lost. The search and rescue teams had to go and help them out. It was confusing. They didn't know where to go. It's such a broad expanse of land. And so one of the other things that we're hopeful for is that we can actually get some resources there, because it's an amazing place and we want to preserve it. More antiquities were damaged with that designation because there wasn't, there was no law enforcement. There's no cultural or visitor center, which is something I'm very proud of that the legislature worked on, the opportunity for us to do that. And so I do think that there is an opportunity for us to do something in legislation that puts an appropriate size on the boundary, stops it from ping-ponging back and forth every 4 or 8 years, depending on who's elected, and allows us to get resources in there where we could have have Native American rangers who are directing tours as well. We really could do something special that protects the antiquities, protects the heritage of that place, and removes the just toxic atmosphere and debate around this. I think it's something we would all like to do. That being said, I have no idea what's going to happen. Obviously, if the president wants to, he can, just with the stroke of a pen. He can do that and doesn't need the legislature. But I think that would be a mistake.
Okay, and we are out of time. So I thank you so much for being here and answering all of our questions.
Thanks, everyone. Have a great day. Be safe out there.